many shots have you gotten in your lifetime? Did they hurt? How can you tell if they're being administered correctly? Carter, Templeton, and McCoy from the Journal of Med-Surg Nursing advise that there are many risks associated with administering intramuscular injections, including injury, but evidence shows that many of the errors that are associated with IM injections are preventable. Well, I'm here to inform you of the correct way to administer an IM injection so that you can tell if you're getting the proper care or not. Today, I'll explain the preparation of the injection site, the process of administering the IM injection, and finally, how the used injection should be disposed of properly. Now that everyone knows what's going to be discussed, let's get started. First, you have to prepare your workspace and your injection as well as the injection site. An article from the Polish Journal of Public Health defines an injection as the delivery of medication into the tissue by means of a needle. In the case of an IM injection, it will be delivered specifically into the muscle, hence intramuscular injection. You're going to want to make sure that you have everything that you need to be easily accessible. Everything I have is laid out right here, and I have my biohazard container behind me. Also, you want to make sure everything is clean and sterile as well so that we can prevent any bacteria from entering the body. According to Cavasso and Weatherspoon from Healthline, IM injections are especially common because they are absorbed extremely quickly by the body. Vaccines and antibiotics are both some common examples of IM injections, so most people have usually gotten an IM injection in their lifetime. Okay, so what I'm going to do first, I'm going to go ahead and prepare the injections. I'm going to prepare the injections. So, I'm going to take an alcohol wipe first. And this is my vial of solution. I'm actually just using a little bit of water. So you're going to clean the top really well, and then you're going to let it air dry. Then the alcohol wipe will be thrown away. You're going to take your syringe, open it out of the package because that means, make sure there's no rips or anything because you want it to be sterile. Also trash that. There's a little cap that makes sure that the needle is covered. So you're going to take that off. And then as you can see, this is dry now. So you're going to take the needle, inject it into the rubber, and then pull out however much solution that you're going to need. For me, I'm just going to go ahead and withdraw just about maybe just a little bit, enough to, make a difference. You're going to take the draw needle, dispose of it properly, take the actual needle, and then cap it. So once you cap it, you're going to make sure that there aren't any air bubbles, and then you're going to push the solution up where it makes sure that it's no air. You don't want to get any air into the body, and that's how you prepare your needle. So it's ready to go. Okay, next we will talk about actually administering the injection. So Dynamed Plus informs us that there are several sites for IM injections, including the buttocks right here at the top, the deltoid right here, which is why I have my sleeve pulled up, and the upper thigh, so it's about right here. So I'm going to use the deltoid for an example since it's clearly in view, and it's something that I can reach. I'll show you, but I'm actually going to administer the injection on my apple over here because I don't want to stick myself. So the location of the injection site will be determined by the size of the needle itself and the amount of the injection within the injection, so the amount of the actual solution. And there's also other factors such as body type, age, weight. So the main thing is you want to pick the site where the solution is guaranteed to be entered into the muscle. So if someone's a little heavier set, you would push down on the skin to make sure you can reach that muscle. But you want to be very careful that you don't go too far, or you want to pinch the skin. That way, if someone's a little smaller, you'll pinch it. That way you don't hit bone. So I'm going to show you how to actually inject someone. But I am going to pull this down because it's a little uncomfortable, a little tight. Okay, so you would take another alcohol wipe. Well, let me trash that one. Okay, first I would have all of my hands and stuff washed beforehand, so I'm going to just use some hand sanitizer. And then I'm going to put my gloves on, since I'm actually going to be touching the person. Usually you're in a very sterile environment, so this is kind of just irrelevant. Okay, so now I'm going to take an alcohol wipe. I'm going to take my apple, and I'll get a little closer, and you're going to want to clean the area of your injection site. You will take a cotton ball and dry that particular side off. And then you're going to take the cap off of your needle. And again, you'll either push down or you'll pinch depending on the person. And you are going to inject the needle straight in. And then make sure that the base is all the way together, and then inject the solution. And make sure that you get all of the solution in, and then pull it straight back out. And if something happens and the patient is bleeding, you would just put a Band-Aid right over the site. Okay, so you want to make sure to inject the needle at a 90-degree angle to the person's body, all the way to the base, and administer the solution fully and pull the injection straight out like I mentioned. Finally, we're going to talk about the disposal of the injection. So after administering the injection, we want to make sure that we dispose of the used injection properly so as not to harm others. When retracting the needle from the body, be sure to do it exactly as it entered, keeping it away from any other part of the patient's body or your person, and place the injection into the biohazard container as soon as possible. Okay. If needed, like I mentioned, place the Band-Aid over the injection and you're all done. So today I've explained how to give an IM injection. I've demonstrated how to prepare the injection site, the process of actually administering the injection, and finally how to properly dispose of the used injection. Hopefully, the next time you get a shot at the doctor's office, you'll know what to look for and you'll know if the nurse is doing what they're supposed to do. You always want to make sure that you're giving the proper care that you deserve.